I'm Kellan Baker. I'm a PhD candidate in the Department of Health Policy and Management at the Johns Hopkins School of Public Health up in Baltimore. And my research focuses on the experiences of transgender communities in trying to access healthcare and looking at transgender health disparities. My research work is informed by the fact that I am all of the letters in the LGBTQ acronym. So I came out as a lesbian when I was 14, and I transitioned in my 20s from female to male actually when I was living in Russia. And the experience that I had there of trying to access healthcare and seeing the differences between the Russian health system and the US health system, when I came back to the States, I realized that that was the type of work that I wanted to do. And I now identify as bi or as queer, so really my personal and professional lives are really wrapped up in the experiences of LGBT people and LGBT communities. I guess one of the stories for me that reminds me of why this work is important, I mean, actually I could think of any number of them. My own experiences in trying to access healthcare, the experiences of my friends, the experiences of transgender people across the country or across the world who are targeted because of who we are, denied access to healthcare, denied access to education, denied access to a job. The most recent thing that I can think of is actually happening on the national policy stage. In 2016, I was working in DC on a regulation that came out of the US Department of Health and Human Services that prohibited discrimination against transgender people in health insurance coverage and healthcare. And that was really important because we know from the research that's out there, and again from my own personal experience, what it is like to try to access healthcare or health insurance coverage as a transgender person. The barriers are enormous, and they are systematic, and they are deadly. And so this regulation was really important because it said for the first time that there need to be these non-discrimination protections at a nationwide level. So regardless of what state you live in, you should be able to get the healthcare you need when you need it. Just recently, the current presidential administration, the Trump administration, put out a proposed revision to that regulation that strips non-discrimination protections for transgender people, not just from that particular regulation, but from every regulation across the US Department of Health and Human Services. And it's hard to say sometimes or to know what role data and research play in trying to counteract something like that. But that's really one of the best tools that we have, is just to keep collecting these stories, keep collecting these data to show the harms that transgender people experience, to show what happens to transgender people when we can't get the healthcare we need, and to try to push back against these attempts to dehumanize transgender people and to push us, to the fringes of society or even beyond. There are people who do not want transgender people to be seen as people to have a role in American public life, and pushing back with stories and hard data about our experiences is an incredibly powerful tool. A culture of health means to me that everyone has the opportunity to be themselves and to live the lives that they want to live. I'm a health person, a public health person, so I really believe in the idea of the social determinants of health. It sounds like a buzzword, but all it really means is that everything about our lives affects our health, and our health affects everything else in our lives. So seeing the interrelationships between different sectors, health, labor, agriculture, transportation, criminal justice, there are so many ways in which working together with people across sectors to move forward policies that recognize that every sector that impacts health has to be involved in promoting health. My discipline is health, and whether you look at that from the perspective of medical care or from the perspective of public health, there are incredible gaps in our systems in the United States. Our public health agencies are dramatically underfunded, and our medical system spends more on healthcare than pretty much any other system in the world, and yet doesn't produce better results. So my hope is that my research will be able to help inform policies that help us rebuild our health system. One of the things that you sometimes hear, right, is that we don't have a healthcare system, we have a sick care system. We have a system that really only cares when you're sick. It's very good at giving some people access to really important and impactful and life-saving care, but it doesn't do enough for enough people. It doesn't actually provide everyone in the United States with access to the life-saving healthcare that they need. And that's not just the sexy stuff. It's not just the high technology. It is primary care. It is preventive care. And what I hope my research will do is to inform the health system as we're making these efforts to change it, to improve it, to get to the place where we have universal health coverage, we have the ability for everyone to get the care they need when they need it. I want my research to be part of that effort to say, when we are rebuilding these systems, we need to make them work better for everyone. And in particular, we need to make sure that they're working for the people who have historically been left out. There's a principle actually in disability organizing called universal design. The idea being that if you build systems so that they integrate access for people with disabilities, those systems will be able to give access to everyone. If a door is wide enough for a wheelchair, it's wide enough for everyone else. And those who are not in wheelchairs will never notice the importance of the width of that door, but people in wheelchairs will. And that's one of the experiences, I think, looking at how people from communities experiencing health disparities interact with the healthcare system. We need to make sure that their needs are being met, because by meeting their needs, we are ultimately serving our society as a whole. The really wonderful thing about HPRS is that it feels like a family. It feels like a place where we come and we let down our guard and we talk about the things that really matter, and also we're incredibly nerdy and incredibly wonky, and we talk about our research and we talk about science, we talk about policy. I was actually a speaker at the 2017 March for Science in DC, and my speech included the fact that I am transgender. And I was talking about the importance of science and the ways that scientists need to be involved in the policymaking process. We cannot remain above the fray, quote unquote. We cannot remain neutral. And the stories that ran in some of the right-wing newspapers were all focused on the idea that it was hilarious that a transgender man would dare to talk about science, because the idea being that my identity is unscientific, that my entire existence is some sort of media myth that has nothing to do with science, and that my entire identity is somehow showing my ignorance and disregard for basic biology. And being in HPRS is the kind of place where I can really feel like my identity, who I am, and my science, my research, are both respected and understood as to how the one informs the other. So it's a place for me to be whole, where I'm not just representing LGBTQ or transgender issues and having people question my ability to do science. And it's not a place where I'm just doing science and having to pretend like who I am outside the confines of the lab doesn't have an impact on how I think about my research questions and why I work on the issues that I do. So HPRS for me is that kind of home where the personal, the political, the policy, the research, the science all come together for me and allow me to be whole.